Health for your information campaign information session. My name is Kanyisa Booi. I am project liaison for this campaign. The aim of the campaign is to make sure that young girls and women access sexual and reproductive health services, as well as clear, comprehensive contraceptive care and comprehensive abortion care. And today we are joined by Dr. Melusi Dhlamini. He is a sexual and reproductive health clinician. Oh, welcome.
Thanks for inviting me.
So where did you come, Vel?
You invited me?
It's a good place to start. I wanted to start with good old-fashioned Skinner. So, Dr. Melusi, I'm just curious about why is it so hard for us to talk about sex?
Okay. A lot of people feel anxious to talk about sex because most of the time people don't have the right words to use, or they think that actually don't have the right words to use.
Right.
But what people don't know is that you actually need to have a conversation about it, and it's as important as any conversation about any part of your relationship.
Right.
So communication is very, very important.
Right.
We are raised in families that do not encourage healthy communication about sex. So we take that kind of upbringing into our adult relationships. A lot of things can happen during the course of your relationship.
Right.
You may have, for example, surgery, you may have an illness, and you may feel like you're not as good enough as you were before
Right.
you had that change in your life. So what needs to happen is the thing about that conversation is that even if you feel like you don't have the right words to use, you're scared to have the conversation. Sometimes you just need to be honest about it and
Right.
say, I'm struggling to talk about sex.
Right.
And that actually makes the conversation much easier for people. And once you have the conversation, you actually see that it's actually easy to actually talk about sex.
Right.
It gets easier.
Look, I want to say this, but I'm not really sure if my words are going to say exactly what I'm saying.
Yeah.
So that the other person can get a sense of I'm struggling, but what I'm trying to say is.
Yeah.
Right.
Yeah. And the other thing is that people think that if you're sexually compatible, then everything should just fall into place.
Not
and
true.
It's not like that.
Not true at all.
You may come from a different relationship where some things were working for you, but you're with a different person now, and things are different. And you may have to change a few things, so you may want to actually have a conversation about that.
Right. I think it definitely is about that human interaction,
Yeah.
and the better the human interaction, the better conversations flow.
Yeah.
I think you brought in a very important element, which is if you are in a relationship, then something happens, you have had surgery, and now you feel like, you know what, I'm maybe not good enough, whether it's my body that's not good enough or my performance is not good enough. But if you are able to talk about sex and having sexual pleasure, you are also able to pull that in. You're also able to pull out conversation about contraceptives as well, because I find that in relationships, people don't ask each other, are you on a contraceptive? So for me, I think I'm trying to pull in you as a clinician. What has been your experience, particularly with contraceptive counseling?
The thing about contraceptive counseling is that when you talk about it, it's always a woman's issue.
Right.
So even if you see a couple, and they consult about conception, is what can she take for us not to have a pregnancy? It's never about the men. And actually, men have options to use contraceptives
Tell
as
us.
well. So I don't like the fact that the burden of contraception is put on women, because we can actually share that burden.
Right.
So and I've seen it in practice when people do the counseling, they counsel the women because they don't want to explore what the man can actually do as part of contraception. You have your options like external condoms, which were previously called male condoms, not male condoms, external
condoms, yes.
And vasectomy.
Right.
And those options are never explored.
Right.
It's always, you can use the pill, you can tie your tubes, you can do that for the women. And I think we're trying to change that conversation to say men have options as well. Let's explore. explore that.
That's fantastic. So tell me about a vasectomy. So I'm saying, so we have a conversation, you and I, we're in a relationship, and we decide we don't want a pregnancy ever in life. And then I'm like, you know what, I'm actually not tying my tubes. So you best then be the one to do a vasectomy. Walk us through like a brief process of what a vasectomy, if a man wanted to have a vasectomy, what's the process there?
Actually, in terms of contraception, vasectomy is the best contraceptive.
Right.
Because if you look at what we call it, the pill index, or what it is actually, it's just how many women fall pregnant on that method per year. How many women per 100 fall pregnant on that option. And vasectomy has I think it's 99.9% effective compared to other contraception.
Wow, that's amazing. That is, I mean, seriously, 100% of pregnancies are caused by men.
Yes.
I feel like definitely a big option worth looking at. Yeah. So my man wants to go for a vasectomy. Walk me through it.
So you need to find a provider who does vasectomies. There's a lot of providers, and it's actually becoming more popular now that a lot of people are exploring the option. There's different ways of doing the vasectomies, but the more popular way of doing it is it's called a non-scalpel. So it's basically an office procedure. You can actually come in, have the procedure, and go back to your office and work. Right. It's actually that easy to do.
You can't. You're joking. No, seriously. Like, no. What do you mean? What do you mean it's that simple? You can. Wait, Nina. Oh. How are people not doing that? There's so many men who go, I've never wanted to have a baby in the first place, who need to know that they can go in, have a smallanyana situation done, and then go back to their offices. How do we not know that? Why is that not general knowledge?
Because we think it's surgery, and number two, we think it's going to affect our
erection.
Our erection, the way we enjoy sex, but it doesn't. And that information actually needs to be,
freely available.
Exactly. We need to get that information out there, because I think a lot of men don't know what vasectomy is. They know it's tying the tubes, but they've read other things that are actually not true about vasectomies. Yeah.
It's very much like abortion. People read a lot of not true things, and then they decide that that's the fact because it's basically worst case scenario.
Yeah.
Right. I think then this moves us to abortion in relation to men.
Yeah.
When is the best time for men to get involved in the abortion conversation?
I like the fact that you said that 100% of pregnancies are caused by men.
Yes.
So if there's a pregnancy, where do you come in? My take on it is that once a woman makes a decision to say that I'm not gonna go ahead with this pregnancy, we don't need your opinion as a man,
right?
Because you're not gonna carry the pregnancy. You can have a conversation as a couple to say, are we ready to have a child? Are we ready financially? Are we ready emotionally? Our life stage we at, are we ready to actually do this? But the decision about whether to have an abortion or not really lies with the woman.
Right.
It's her body, it's her choice.
Right.
If you as a guy says that, you know what, I think we should have a baby, and the woman says, nope, I'm not ready, you really don't have a say in whether the pregnancy goes ahead or not.
Right.
The woman decides what her body is going to do.
Absolutely. So I agree with you on that. So for me, what I'm thinking about right now is we've just spoken about a vasectomy.
Yeah.
And like it's a big screaming for me right now. And when you were saying right just now about how men would say that, oh, I want to have a child with you, and then I say yes, or I say no, whatever the case may be. And then I remember you tweeted about how, why is it so strange when people see couples going in for an abortion? What was that? What was that based on? Why were you asking that question?
When people come for consultations for abortion, they ask a lot of questions. Sometimes it's actually people in relationships or in marriages,
right?
And it's a woman who just comes by herself,
right?
Because she found out she's pregnant and she's not ready, but she's not ready to tell the partner that she's pregnant because the partner might be excited and force them to go ahead to carry the pregnancy. So the reason I tweeted that was from my experiences in consultations when when you tell other people about other people's experiences and they get shocked that couples actually come and say, yeah, we married, but you know what, we've got a 6-year-old and my wife just lost a job, we can't afford a pregnancy, so this was a mistake, so we just want to have an abortion. Because people think that once you're in a marriage, every pregnancy should result in a child, and people have an option to say no. We are pregnant, but no, not now. We can try in 2 years' time, but not now. So that was for me a shock because I thought, and that I think in the same tweet I asked, but what do people think abortion is? Because I when you are shocked that people actually come as a couple to have an abortion, what do you think abortion is? Do you think that pregnancy is something that, once you have in marriage, you don't have any other option?
Yeah, because of how we identify a pregnancy as, and also how we've made abortion a thing about a woman who is desperate and feels that their only option is then to abort, and she didn't want to, and it's like this thing where if she could, then she would.
Yeah.
Assuming that everybody wants to have a child.
Yeah.
Everybody wants to carry through a pregnancy, which is not necessarily the fact. And we all know that there's also sex workers who are doing sex for work, and it's very difficult to negotiate safe sex work. If you've got a pregnancy, you don't want to carry on with the pregnancy.
Exactly.
I think for me, what that anchored is Uguti. Even in marriage, people are like, no, we're having it recreationally. We're not wanting to birth
and
things.
Then this happened.
And then this happened, and this is an option for us.
Yeah.
And so we take that option and we look at it. But I think I really want to dig into the actual clinical process. So I am Kanyisa. I come in.
Yeah.
I am. What is the process? In terms of if I am seeking an abortion.
Yeah. So when you come for an abortion, what I like to because an abortion is a result of an unintended pregnancy.
Right.
So how did we get to a point where we had a pregnancy that we didn't want to have? So we addressed that. Sometimes people actually plan the pregnancy, but then because of circumstances, they decide, no, we can't carry on with this pregnancy.
Right.
And that's fine. But sometimes people get pregnant because they're not on contraception, it failed, they got raped.
Backtrack.
Yeah.
Contraceptive failing. Please. Belly forward, man. Let's talk about contraceptives failing.
Yeah. So there would be different reasons why they would fail.
Right.
So the pill.
Right.
Which everybody knows. One, antibiotics. People don't know that. So antibiotics make your pill less effective.
Right.
So when you are on your antibiotics, use a condom for the duration of that period, even after, a few days after you're on the pill.
Children, antibiotics, pill, condom.
Another thing is because it's a pill that you have to take every day, some people forget.
Right. Yeah.
So sometimes you think, did I take it yesterday or not? And you don't remember, and you're just like, what? And you're about to have a good time, and you do have a good time, and actually you didn't take it yesterday. The thing about the pill is that you have to be consistent.
Right.
When you're taking it for it to work.
Right.
There's a lot of medications that you would take that would make your pill less effective. The other thing about your contraceptive, if your condom breaks.
Yeah.
I mean, if you have a loop, an IUD, if it's not placed properly, it could still.
Is it true that babies sometimes come out of wombs with IUD?
I delivered a baby that had the loop here, which is funny.
No mag.
I have a picture.
No mag. No mag. Oh my god.
Okay. So the thing about contraceptives is that they're not 100% effective.
Of course.
The only thing that is effective is abstinence, and I don't think a lot of us want to do that.
No.
So vasectomy is the best.
Yes.
And then you've got,
every other method after that.
Yeah. The condom's been less effective because they break.
And also people abazozisebenzisa but abafuna ufundiswa at the same time.
Yes.
But that's a whole other conversation. I'm sorry. I redirected. We were talking about you were taking me the process of asking or of requesting an abortion. You're saying you find out the reasons why.
Yes, that's me.
You need, yes.
Yeah. So once we over that, then we say, are you pregnant? So we do a pregnancy test, say you're pregnant, and then we do a little bit of an examination and we do a scan just to see if the pregnancy is inside the womb. Because sometimes you're pregnant, but it's actually outside the womb, which is a whole different story.
Right.
Once we say, okay, you're pregnant, it's inside the womb, how far pregnant are you? Then the methods come in. So you've got two different ways of doing the abortion. You've got the medical way of doing the abortion, and you've got the surgical way of doing the abortion.
Right.
The medical way is just basically medical. It's just pills.
Right.
So we give you 2 sets of pills, and then you go home and you have the abortion there. Right. Sometimes, depending on the how far pregnant you are,
right.
you either go home to have the abortion, or you can have the abortion in your health facility. The surgical abortion, basically, you're just using something like a straw, the size of a straw, just to get the pregnancy out. And in that case, we still use a bit of medication just to, make the womb a bit softer, contract, whatever. Pain medication also. So yeah.
Okay.
And
it sounds simple enough. I say simple enough because I think sometimes we've got an image of what it looks like, and because anti-choice people have put up such horrific pictures of what a pregnancy is at this stage and what the process looks like, and what you're describing is 2 very simple processes, and we understand that obviously there would be other scenarios where there could be complexities, but if you're at a facility that is providing, then you're safe. I wanted to find out, so for example, I am 8 weeks pregnant. And I go and I check. Does it show?
Yeah, so pregnancy, depending on the skill of the person who's doing a scan, your pregnancy can show about 5 weeks.
Right.
So around 5 weeks, then you can start seeing your pregnancy. It does show, but then it's just a little ball with nothing inside.
Right.
So people, like you were saying, your anti-choice people, when they talk about abortion, they will show you a woman who is 8 months pregnant, huge tummy, and they would show you this huge fetus, and they would talk about abortion, and that is not abortion.
Right.
Abortion happens in South Africa at less than 20 weeks, and that's very early. At that point, you're not even showing.
Right.
Sometimes people don't even know that they're
pregnant
at that time.
Right.
So it's very easy actually to do an abortion in less than 20 weeks.
Okay. Thank you for that, because I think that's a very, very important thing to say, that first of all, in this country, it's less than 20 weeks. And secondly, the best thing you can do for yourself when you've made that choice that you want an abortion is to go to a designated health facility. Because I think some of the stereotypes and all of this other negative stuff come from the fact that people go to unsafe places. So these posters that we see, we go and we have abortions done there. I wanted to find out if you've seen any cases of people who have been to backstreet abortionists.
Yeah. So
those people are also judged as they're not abortion providers.
Yeah, they're criminals. When I started practicing obs and gynae, I think within 6 months I had 2 people die from backstreet abortions. So what happens with backstreet abortion is that we did a documentary for I think ETV Checkpoint, and one of the things that we did during the documentary was to go undercover, and call one of these numbers that they see on the street, and what they did was to actually meet them in the car.
Right.
So that guy just met them in the car and then gave them pills. Didn't ask how far pregnant you are, didn't do anything to make sure that actually your pregnancy is inside the womb, and this is safe for you, this is the right dose of pills to give you.
Right.
So that's exactly what basically abortions do. They're about money.
Right.
You're pregnant, you did a test, it's positive, okay, give me this much, I'll give you this many pills. That's it. And that's very unsafe because, like I said, depending on how far pregnant you are, there's different
methods
of doing it. So what happens is that they give you the pills, you be at home, and they don't tell you any other information. The two people that I'm talking about that died, they were given pills, went home, they bled for a week. So imagine bleeding for a week. You are bleeding your entire blood system out. When they came in, there was nothing we could do. We tried, took them to ICU, but unfortunately, didn't work out. So vaccine abortion, very, very unsafe.
Wait, I don't even have words because I'm imagining what that person and their thinking is around when I can feel literally the life going through them.
Yeah, the thing about that is that you are desperate to end this pregnancy,
right?
But you don't either have information or you don't have access to that health service,
right?
And that's where our government is actually failing us, because as much as we try and say that this is a health service is available, is it really?
Oh, yeah,
I mean,
true.
I was in a practice last week, and somebody told me that in the clinic in Soweto they only see 5 patients per day, and I can tell you there's probably like 100 people that need that service in that clinic that day. So if you see 5 only, what about the other 95? They're so desperate to not have this pregnancy carry on, they will go backstreet because the thing about vaccine abortion is that the advertising is much more in our face than our health. Our safe abortion facilities. So the first thing that a person who wants an abortion sees is that poster, and what are they going to do? They're going to try to find money and go to that guy.
I think as we were about to wrap things up, I wanted to ask 2 questions. The first one being, do you think that abortion providers in the health system, especially where it's supposed to be free, are supported enough? And then the second one is, what are the deficiencies?
I'll start with the second question. Like I said, access to information, so people don't know. If I were to just ask somebody on the street now, what does the law say about abortion?
Right.
Trust me, they would not know. So if you want people to access safe abortions, why are we not getting that information out?
Right.
And that's a duty for our government, and they're not doing that. In terms of providers in facilities, I will tell you about my experience. I worked in a big hospital where there was, in our department, I think there were more than 25 doctors,
right.
and the other doctor were trained, but he was not practicing. He was not providing the service because, you know what his reasons was? He dreamt of babies at night, and then he just stopped. Stigma. So imagine me being the only person in a department who provides. That's a lot of that's a lot of work, because when I was working, I was not only doing abortion care. I was doing other things because it's an obs and gynae department. I have to do other things. I've got clinics. I've got ward rounds. I've got other things plus, and I was not even getting time to actually do that. So I had to find my own time during my schedule to actually see my abortion patients. So it was a lot of work. And the other thing about abortion is that when you practice or when you provide the service, it's very emotional because people come for abortions for a lot of reasons, either choice or circumstances, whatever the circumstances may be, and you end up taking a lot of that. I mean, if people are raped, if people, you end up just taking a lot of that, and
of the psychological care as well, not just providing the service, but you also need to take in, because you have to ask the question of how did we get here. And so it's almost like the pre-counseling is heavy for you.
And you're not trained on being a counselor, you're not trained on being a supporter. You just happen to be in a situation where it's very emotional for the person, and it's difficult for you to in that process. And 30 minutes is gone, next, but you're still thinking about that girl who's raped, doesn't want to say anything, who's raped by her dad, and sometimes you just feel so helpless that I want to help you, but I can't, because
systemically you don't have the time to actually give care, like proper care. And I guess it's what you're saying, like, and also it's, I mean, we work in the, personally I'm in the NGO sector, and I know that there's requirements for the government to do certain things, and I think there's capabilities that NGO sector also has, and I think if the two are speaking to each other, some of these things would be like on-site NGO that does counseling can do the pre-counseling so that you are able to do the actual provision.
Yes,
and so that clinical. It's a beautiful flow, and women actually walk out of that. If they want to conceive after the fact, they can carry on living their best lives. Look, I'm going to have to wrap it up. But if there was 2 things that you wanted to say to women, or to South Africans or whoever's actually watching this, what are the 2 things you really want to say about abortion access, particularly?
One, you have to make sure, if you're gonna ask for an abortion, make sure that it's a safe abortion.
Right.
So the things to look out for, I mean, you have to be asked about contraception. You have to be asked about a lot of other things, HIV, pap smears, other things, which is funny because that actually goes into that conversation about abortion. It's women's health, so let's use that opportunity to actually talk about other things that don't necessarily are involved in abortion. The person has to be trained. It has to be a center that is designated by the government to provide the service.
Right.
So if you meet somebody behind some building in
Dodge.
A car, no, they're probably not safe.
Right.
Even if they say on their advertising, quick, safe, cheap,
pain-free.
No. They're probably lie. The other thing is that you know what, if you fall pregnant and you feel like you're not ready, or you don't want to, or even if you were ready, but during that process of pregnancy you feel like, no, I can't, it's your choice. You have the right to actually say, I'm not going to go through with this. I'm having an abortion, and you don't feel ashamed about it.
Yeah, and that was Dr. Melusi Dhlamini. Thank you so much for making time. And this is the Sexual and Reproductive Health for Your Information campaign. The hashtag is SRHFYI. I'd like to thank you, Constitution Hill, for being the centerfold for us to speak about human rights, because abortion access, sexual and reproductive health access is in fact a human right.